Mental Health First Aid, Youth and Teens, a presentation by Precious Light Suicide Prevention. The mental health crisis in the nation is intensifying, particularly among young people. Recognizing and addressing the signs and symptoms of mental health issues is crucial. Doing so enables us to connect our families, friends, colleagues, students, and community members with the care they need and deserve. Through consistent annual training of individuals as mental health first aiders, we are better prepared to identify and assist those who require support. Recognizing signs of mental health challenges can be challenging. Friends and family may notice a loved one struggling, but often lack knowledge on how to intervene or direct them to appropriate treatment. Similarly, individuals facing mental health challenges may be uncertain about seeking help or whom to approach, and consequently, many who need mental health services do not get the necessary help until it's too late. Nationally, there is an alarming rise in both completed and attempted suicides. Mental health first aid, similar to physical first aid or CPR training, equips individuals with the skills to recognize, understand, and address signs of mental health issues. This evidence-based program educates participants about the risk factors and indicators of mental health problems, enhances understanding of their impact and presentation, and outlines common treatments and local resources. The training employs scenarios, interactive activities, and a 5-step action plan to give participants practical, situation-specific abilities to evaluate a mental health crisis, offer initial assistance, and guide individuals to professional, peer, social, and self-help support. Who can benefit from this training? Parents, teachers, first responders, students, veterans, doctors, nurses, caregivers, law enforcement, judges, etc. Why is learning mental health first aid important? 1. Mental health issues are widespread, with nearly 19% of adults in the United States, or approximately 43.8 million individuals, experiencing mental illness each year. Similarly, around 20% of children and adolescents are estimated to encounter a mental health issue within any given year. 2. Stigma is often linked with mental health issues. The negative perceptions and behaviors surrounding mental health and their treatments may lead those affected to conceal their struggles and forego seeking the help they need. 3. Many individuals are not adequately informed. Some may not recognize mental health issues, know how to respond, or be aware of effective treatments. 4. Professional assistance is not always readily available. In its absence, the public can provide immediate first aid and guide those in need towards suitable support. 5. Few are knowledgeable about the appropriate response. Participants are taught a 5-step action plan to support someone experiencing a mental health crisis. And 6. Often those with mental health challenges do not seek assistance, either due to a lack of awareness of their condition or ignorance of the available help. In the U.S., only 41% of people with mental health issues received professional help in the previous year. Mental health first aiders are trained in a 5-step action plan to identify the warning signs of mental health challenges. They offer assistance in crisis and non-crisis situations and know where to seek further help. The 5-step mental health first aid action plan, which will include a specialized segment on suicide prevention, which covers the identification of suicidal thoughts and behaviors, along with protocols for safe intervention with our program model, Elpee. E. Evaluate for risk of suicide or self-harm. L. Listen without being judgmental. P. Provide support and information. E. Encourage to seek professional help. E. Encourage self-help and offer support. In-person training allows individuals to engage in instructor-led sessions conducted over a single 7.5-hour day, 2 4-hour days, or 4 2-hour days. No pre-work is required. In key takeaways, individuals will learn how to recognize, comprehend, and address signs of mental health challenges, and this includes crisis de-escalation techniques and scenarios. The cost of materials is $40 per participant. The instructor fee is $1,200.